do we need calcium tablets or it's just a marketing myth? As an orthopedician, patients usually come to me and ask, Doctor, should I take calcium tablets? Are they good or bad? So today I'll break down the facts, the myths and science behind it in a simple language. Calcium is essential for bones, joints, muscles and even for the heart rhythm. But that doesn't mean that everyone should pop the calcium pills. So let's separate the facts from the myths. Coming on to the first myth, everyone above 30 must take calcium tablets. But the fact is, it's not true. Majority of the adults with a healthy diet get enough calcium through food. So tablets are needed only when there is a deficiency. Coming on to the second myth, more calcium is associated with stronger bones. But the fact is, bone strength does not depend on calcium itself. It also depends on vitamin D, magnesium, weight-bearing exercises and hormones. Coming on to the third myth, calcium tablets must be taken in the morning. But the fact is, timing doesn't really matter when it comes to calcium tablets. But yes, there are certain forms of calcium that has to be carefully taken. The carbonate forms are best with meals, whereas the citrate forms can be taken anytime. But calcium tablets has to be always avoided when we are taking it with iron supplementation because of the absorption issues. Coming on to the fourth myth, calcium alone can cure osteoporosis. But the fact is, calcium is just supportive treatment but not curative treatment. Myth fifth, natural calcium food is not enough. But the fact is, most of the people need daily needs with food like milk, curd, paneer, ragi, almonds, sesame, green leafy vegetables and fish. So who actually needs calcium tablets? The people who are a pregnant and lactating women, postmenopausal women, elderly above 60 years, people with vitamin D deficiency, patients with fractures, people with low dietary intake, and long-term steroid users, and those who have been diagnosed as osteoporosis or osteopenia. So how much calcium we need to take on daily requirement? So on an average, an adult will require 1000 mg per day, whereas women who are greater than 50 and men greater than 70 will require almost all 1200 milligrams per day. What are the common mistakes with calcium tablets are that calcium has to be always taken with vitamin D, but people don't take vitamin D. As a result of it, it makes calcium just a mere tablet. Taking high doses just to be safe is not correct because it can lead to other conditions like kidney stones, constipation and vertebral artery calcifications. Drinking very little water is another thing that people do after taking calcium tablets. So what are the things that we need to do on a regular basis? You need to get vitamin D levels checked. Prefer always calcium citrate because of its easier digestion. Stay hydrated. Always do strengthening exercises that I always say to my patients. Prioritize food sources like that I have already discussed earlier. So the calcium tablets are not a myth, but they are also not for everyone. When used correctly or only when needed, they help maintain the bone health. But unnecessary intake can do more harm than good. So that's why one has to be very careful whenever they are taking calcium tablets.